Welcome back. Now we're going to talk about Unit 11, Meeting the Residents' Need for Elimination. Now we're going to state the importance of accurate measurement of recording intake and output. It's also called I and O. Importance of accurate measuring and recording of intake and output is helpful to monitor the medical treatment of residents with certain diseases. For example, the effects of a diuretic medication or any other progressive disease with a condition that would make a resident have fluid retention or edema, swelling. Intake and output measurements are used by the physician to make a diagnosis or to decide the kind and amount of medication to prescribe. Accurate measurements and recording is vital. Now we're going to talk about the methods to measure and record fluid intake. Liquids and foods that are liquid at body temperature are included for the intake measurement. The nurse will measure other fluid intake from sources such as IV or tube feeding. We always use the measurement in milliliters, ml. Another name for this is volume in cubic centimeters, which would be cc's. However, we do no longer use cc. We measure everything in milliliters. The facility will usually have a list of the volume of its standard mealtime food containers. Using this list for a reference, the CNA can estimate the volume of a liquid consumed. Accuracy is the result of paying attention. The CNA needs to know how to convert measurements in ounces to milliliters. In 1 ounce, there is 30 milliliters. You need to remember that. The CNA must ask for assistance if unsure of how to estimate measurement or to convert ounces to milliliters. The CNA is going to record the intake consumed at the end of each meal or snack and when bedside water glass is refilled. The total amount of the fluid at the end of each shift and at the end of a 24-hour period. We start over every night at midnight, and then we would go to the following midnight. That's our 24-hour total. Now we're going to identify the meaning for encouraging fluids, restricting fluids, and NPO, nothing by mouth. That's one of your abbreviations you need to know. Encourage fluids. That's our goal, is to increase oral fluid intakes. We talked about this in Unit 10. At times, a resident will be on a fluid restriction. This is a doctor's order. A fluid restriction would be a limited amount of fluid per a 24-hour period. Also, there'll be times when a resident is NPO. That means they can have nothing by mouth. The resident has no oral intake or on food and fluids. Now we're going to talk about methods to measure and record fluid output. Fluid is measured and recorded. Usually this includes urine and emesis. Emesis is vomiting. Also, when residents are incontinent, we always record the number of times that they are incontinent. Remember, incontinent means lack of bladder and bowel control. So they will use a brief or an attend. We should never call it a diaper. That is very degrading. It's a dignity issue. Now, with female residents, they will either void into a bedpan or a specimen pan that is placed underneath the seat of the toilet or the commode. We need to measure it after each voiding or urination with the graduate measuring cup. Then we need to record that measurement with each urination or voiding on the I&O sheet, the intake and output sheet. For male residents, they will usually urinate into a urinal. Now, a urinal does have a measurement on the side of it. You can use that. Then you can record after each void or urination, again, on the I&O sheet. Now, some of your residents are going to have what's called a urinary catheter. This is a catheter that is placed into the bladder to drain the bladder out. They have no control over it. It goes into a bag, and that's how we collect their urine. Now, we need to empty that bag frequently, especially if they have are given a diuretic and they are putting out a large amount of urine, because that bag will get very heavy. We'll talk a little bit more about that later. But you will empty the bag into a measurement cup, and then you will need to document that. There is some special care, however, that is required to prevent introducing microorganisms into the urinary catheter system. And we'll do that when we have our skills day. We need to record the total amount of fluid output at each shift and at the end of 24-hour period. Remember, at midnight starts a new 24-hour period. So after every shift, you need to document the fluid output for your shift. Then the next shift will do the same, then the next shift will do the same, and then we'll get a total for a 24-hour period. Now we're going to talk about actions by the CNA when assisting a resident with elimination, urination, voiding, or defecation. We need to always remember privacy. It's very important that we give our residents privacy. It's also good to understand the residents' regular toileting habits. For an example, if you know that Mr. Smith has a BM, a bowel movement, every morning after breakfast, and he's been incontinent, is there any reason why we can't just go and place him on the toilet after breakfast and see if we can have him have his BM in the toilet? Well, there's no reason why we can't. If you know their habits, their toileting habits, if you know when they regularly have a BM, try and place them on the toilet so that we don't have the incontinence. Provide for privacy by closing doors and curtains, and also by covering the resident up if they use a bedpan. Remember mobility. Use good body mechanics and lifting devices as appropriate for the resident that's stated in the care plan that we'll talk more about in Unit 13. We need to also remember standard precautions. You must use standard precautions while assisting the resident with urination or voiding and defecation. Always position the call bell and toilet paper within their reach when they are in the bathroom. There's always a call light button in the bathroom. You should always give them some privacy when they're in the bathroom, so you can stand outside the door so that they can be, and do their business by themselves. Nobody likes to have somebody watching them trying to urinate or have a bowel movement. So make sure, though, that you don't go too far, because you're going to need to answer the call light as quickly as possible when they're done. Skincare, you need to assist the resident in providing for good skin care, peritoneal care following voiding or defecation. Remember, with females, we always wipe from front to back. Hand washing is also extremely important, not only for you, but for the resident. So assist the resident with washing his or her hands after voiding or defecating. Reporting unusual appearance of urine or feces is extremely important. Now, one of the things that the state wants you to know is what to report. So, if there's anything unusual about the urine or feces, do not flush them. Get the nurse and let her look at it. That way she can see what's going on with the resident. So, do not empty the urinal or the bedpan or flush the toilet if the urine or the feces looks unusual. Notify the nurse immediately. Now let's talk about some safe procedures for assisting residents in using the commode or the toilet. We need to position them in the correct position. The upright position is more familiar and usually easier for the residents to void or defecate. Make sure that they are comfortably seated. Sometimes some of those bedside commodes that are not very comfortable. You might need to put a pillow behind their back. Males usually stand to urinate or void. At times, we'll put a riser that is placed on the toilet seat to assist the resident to sit and rise up from the toilet. This gives them a little bit more, makes them sit a little bit more higher up. We also have handrails for them to help themselves by pulling up on the handrails. You do need to stay with the resident, especially if they have some safety issues or if they're unstable. Do not ever restrain a resident on a commode or a toilet. That is a violation. We can never restrain a resident. Allow the resident to remain on the commode or toilet, and always know your facility policy about elimination. Check in at least 10 minutes. Check and see if the resident's done. Also, remember to monitor that call light. It should be within their reach. They should be able to pull that call light button when they're done, and you should be there as quickly as possible. Assist the resident from the toilet after 20 minutes, unless directed by the nurse. We don't want them to sit there for a long period of time. If they're sitting there for a long period of time, why? Be that detective. Are they constipated? Are they having some kind of pain when they're urinating? What is it? Go and talk with them and find out. But after 20 minutes, we need to get them up and then notify the nurse. Cover the commode bucket while carrying it to the toilet to dispose the content. If you have a resident that is by the window and the toilet is on the other side, because there's usually 2 beds in a room, we need to always cover it. It's an infection control practice. Cover the commode bucket or the bedpan while you're carrying it to the toilet to dispose of it. Then you should clean the bucket or the bedpan before replacing it. Now we're going to talk about different types of bedpan. There's a regular or a fracture pan. And when you come to skills, we'll be able to show you this more clearly. But the residents might need assistance to be able to get onto the bedpan. You also need to make sure that you follow standard precautions when you are placing them on the bedpan. That would mean wearing gloves. Then, when they're done, you're going to cover the bedpan while you carry it to the toilet to dispose of the content. Then you're going to clean the bedpan before storing it in a plastic bag. The bedpan needs to have the resident's name on it, because remember, there are 2 people in most places in one room, so we need to know whose bedpan is whose. It's an infection control practice. We don't want to mix them up. Males usually urinate on the side of the bed or standing up. They should never be left alone if they are unstable, if they don't have good balance. We need to be there in case they fall. We don't want them to fall. You need, again, to follow standard precaution steps. Wear your gloves anytime you come in contact with any body secretions. Clean the urinal before storing or returning it to the resident. Please always make sure that the males have their urinals within reach so that they can use them when they need to. Caring for residents who have been incontinent of urine or feces. Incontinence, again, is the inability to control their elimination. There are some consequences, however, of being incontinent. One of them is discomfort and embarrassment for the resident. You know, these residents really do get embarrassed when they have an accident, when they're incontinent. So we need to be very careful of our nonverbal expressions, our body positions, and what we say. Another big thing is potential for skin breakdown if the urine or the feces remains in contact with the skin. We need to change residents as soon as they have become incontinent. When residents are incontinent, we usually check them at least every 2 hours or PRN as needed. Again, understanding the residents' regular toilet habits is really something good to know, because then you can toilet them. Just because they're incontinent doesn't mean you still can't toilet them. Check the care plan for restorative goals and activities on the toileting program. Make sure you always answer the call light promptly. Never make the resident wait for a long period of time. When they need to go to the bathroom, they're going to turn on that call light and they're going to hope that you're going to come right away. If the resident has a history of the inability to control their urine or feces, check regularly for incontinence. Again, at least every 2 hours. This practice is called check and change. Always provide for privacy. Respect the resident's dignity by retaining a positive attitude while changing their clothes or their bed linens. Use standard precautions while providing care. Clean their skin and provide peritoneal care using mild soap and water or skin cleaning sprays or wipes. Observe for signs of skin redness or irritation. Any changes in the skin needs to be reported immediately to the nurse. If they were to get a rash, or if they've got something that's open, or if they've got scratch marks, anything needs to report to the nurse. It has to be documented by state and federal regulations. Adult briefs or clothing protectors may be used. Again, we do not call them diapers, adult briefs, or depends. Clothing protectors or incontinent products are to be changed when they are wet or soiled.